So, you've decided to become an occupational therapist. Congratulations! You are embarking on a journey into one of the most creative, compassionate, and frankly, awesome professions out there. Occupational therapy is this amazing field where you help people do the things they want and need to do. These occupations are everything that occupies your time. Getting dressed, making breakfast, playing video games, hugging a loved one. As an OT, you get to be the architect, the coach, and the cheerleader who helps people rebuild their lives, one block at a time. But here's the thing about having this kind of power. The power to genuinely impact someone's daily existence. With great power comes great responsibility. And in the world of healthcare, that responsibility is guided by ethics. Ethics aren't just boring rules. They're the invisible framework that ensures we use our skills for good, that we respect the people we work with, and that we build trust. The IOTA Occupational Therapy Code of Ethics is basically the constitution for our profession, organized around 6 core principles. Think of these 6 principles as your ethical compass: beneficence, non-maleficence, autonomy, justice, veracity, and fidelity. Each one is a guiding star when you're lost in the ethical woods. They are the fundamental tenets that make OT, well, OT. So why do you, a bright-eyed student, need to know this stuff right now? Because ethical thinking isn't a switch you flip on graduation day. It's a muscle you have to start building from day one. You'll start practicing on classmates, then on real clients during fieldwork. You will face ethical questions immediately. Should you tell your supervisor you forgot to document a session? What do you do if your client tells you a secret they don't want their family to know? This code is your training manual. It helps you analyze situations, weigh different factors, and make decisions you can stand by. It gives you a common language to talk about dilemmas with professors, supervisors, and peers. It protects the public by ensuring high standards, and it protects you by giving you a clear framework for making defensible choices. So let's stop talking about the map and the abstract and start exploring the territory. We'll take it one principle at a time. This is where the real adventure begins. Think of this as your initiation into a secret society, a society of helpers committed to doing the right thing, even when it's hard. These aren't just 10 secrets. They are 6 promises you will make to your clients, your colleagues, your profession, and ultimately to yourself. They are the keys to unlocking a practice that is not only effective, but also deeply, profoundly good. Ready to learn the handshake? Let's go. Our first principle, beneficence, is a fancy word for a simple idea: do good. It means all your actions as an OT should promote the well-being and safety of your clients. This is probably why you got into this field. You want to help people. It's about using your knowledge, your skills, your compassion to make a positive difference. It's the proactive part of our ethical duty. For example, working with Mr. Henderson, who had a stroke and wants to cook again. Beneficence means breaking down cooking into manageable steps, assessing for safety hazards. It might involve recommending adaptive equipment, one-handed cutting board, jar opener, and celebrating his progress every step of the way. But beneficence also has a subtle side. It's about being mindful of the costs and benefits of therapy. Is the therapy worth the time, effort, and money? Are you pushing too hard, causing frustration instead of progress? It requires you to be reflective, constantly asking, is what I'm doing truly helping? Is there a better way? Our second principle, non-maleficence, is the essential counterpart: do no harm. This famous Hippocratic principle is central to all healthcare professions. It's the baseline, the absolute minimum standard. While actively trying to help clients, we must avoid causing them injury, pain, or suffering. This harm isn't just physical. It's emotional, psychological, financial, and social. Non-maleficence is the safety net ensuring good intentions don't lead to bad outcomes. The most obvious application is physical safety. You wouldn't ask a client with poor balance to stand on a wobbly surface without proper support, like adjusting a walker for stability. It means not practicing while impaired. being sick, exhausted, or under the influence. It means maintaining professional boundaries and never entering exploitative relationships. These relationships can cause immense emotional harm and are a huge ethical red line that should never be crossed. Consider Maria, struggling with handwriting. You find an intensive program promising quick results, but it's rigorous and known to cause frustration and anxiety in some children. Non-maleficence means weighing potential benefits against potential emotional harm. Is faster progress worth putting Maria through stress? Or would a slower, more child-centered approach be safer and ultimately more beneficial? Non-maleficence asks you to pause and consider the risks. This principle extends to professional conduct. Spreading gossip about a client can harm their reputation and dignity. Neglecting proper documentation could lead to insurance denial, causing financial harm. Even using outdated techniques could be harmful, wasting the client's precious time and resources without real benefit. Non-maleficence is the voice of caution, the constant reminder to think before you act. Always prioritize the safety and well-being of the people you serve above all else. Next is autonomy, and this one is huge. Autonomy recognizes the right of every individual to self-determination. In simpler terms, your clients are the experts on their own lives, and they have the right to make their own decisions about their care. This includes the right to agree to treatment, and just as importantly, the right to refuse it. You're not a director who barks orders. You're a collaborator, a guide, and a resource. Practicing autonomy means engaging in informed consent. This is more than getting a signature. It's about having a real conversation. You must explain proposed therapy in understandable terms, including potential risks, benefits, and alternative options available. For example, with Sarah, a teenager with anxiety, you wouldn't just say, "We're doing mindfulness." Instead, explain what mindfulness is, how it might help her anxiety, what the exercises feel like. Then ask, "Is this something you would be willing to try with me?" But what happens when a client's choice seems wrong? Imagine Mr. Chen, who's had several falls. You recommend a walker, but he refuses, saying it makes him feel old. This is a classic ethical dilemma. Autonomy says you must respect his decision. Your role shifts from convincing to using OT creativity to find another solution. Maybe work on strengthening his legs, modifying his home to remove hazards, or exploring a more stylish cane he finds acceptable. You honor his no and work within his boundaries. Autonomy is also about protecting privacy and confidentiality. The information they share is theirs, not yours to share without explicit permission. This builds essential trust. Respecting autonomy means seeing clients as whole people, not just diagnoses to be fixed. It's about empowering them to drive their own recovery journey. You are the knowledgeable co-pilot, but they hold the map and choose the destination. Let's talk about justice. In the OT Code of Ethics, justice isn't about courtrooms. It's about fairness, equity, and objectivity. This principle demands we provide OT services fairly and accessibly to all people, regardless of age, gender, race, religion, sexual orientation, or socioeconomic status. Everyone deserves a fair shot at receiving needed care. Justice is the conscience of our profession. It pushes us to look beyond individual clients and consider societal systems that create barriers to health and well-being. In practice, justice means you advocate for your clients. You might have two clients with the same diagnosis, but different insurance. Justice compels you to provide the same high-quality care to both, spending extra time helping the uninsured client find resources. Apply for financial assistance, navigate complex systems. It's about leveling the playing field, ensuring ability to pay doesn't determine quality of care. Consider this. Your clinic has a long waiting list. Your supervisor suggests prioritizing clients who can pay out of pocket for better profits. Justice requires you to challenge this. Advocate for a system prioritizing clients based on medical need, not wealth. This can be uncomfortable, especially as a new graduate, but justice calls us to be courageous, speaking up against discriminatory practices. It applies to following rules for billing and documentation appropriately. We have responsibility to be aware of laws negatively impacting client access and get involved in advocacy efforts to change them. Justice is the most outward-facing principle. It asks us to be not only good clinicians, but also good citizens, working toward a world where everyone can live a healthy, meaningful life. Our fifth principle is veracity, a fancy word for a simple concept: truthfulness. Veracity means you must be truthful, honest, and comprehensive in all professional communications with clients, colleagues, supervisors, and insurance companies. This might sound obvious, of course you should tell the truth. But in the complex world of healthcare, truth can get complicated. Veracity anchors us. It reminds us that trust is built on honesty, and without trust, we can't really help anyone. In client interactions, veracity means being upfront about qualifications. As a student, you must always introduce yourself as a student therapist. Be honest about potential therapy outcomes. You can't promise cures or guarantee results. If a client asks a question you don't know, say, "That's a great question, and I don't know the answer right now, but I will find out for you." This is so much better than making something up. Honesty builds credibility. Dishonesty shatters it instantly. It's about being a reliable source of information. Let's think about documentation, where veracity is tested daily. Imagine you had a busy day and only spent 30 minutes with a client, but the standard billing code is for 45 minutes. It's tempting to write down 45 minutes to save time or make productivity numbers look better. But veracity demands you document what actually happened. You must be accurate and truthful in notes, billing, and all professional writing. This isn't just about avoiding fraud, it's professional integrity. Your documentation is a legal record and must reflect the truth. This principle comes into play when you make mistakes. And you will make mistakes. Everyone does. Say you give advice that turns out incorrect, causing a minor setback. It's tempting to hide the mistake, but veracity requires taking responsibility. Report the error to your supervisor, inform the client if appropriate, and take steps to correct it. Owning mistakes isn't weakness. It's a sign of profound professional strength and commitment to ethical practice. Finally, we arrive at our sixth principle, fidelity. This one is about faithfulness, loyalty, and keeping your promises. As an OT, you have a duty to be respectful and fair to your clients, colleagues, and other professionals. It's about treating everyone with dignity and discretion. Fidelity governs our professional relationships. It asks us to be good colleagues, respectful team members, and trustworthy professionals. It's the glue holding the professional community together, ensuring we work collaboratively for the good of those we serve. For students, fidelity is crucial in relationships with classmates, professors, and fieldwork supervisors. It means you don't talk badly about colleagues behind their backs. You follow through on group project commitments. On fieldwork, you respect facility rules and culture as a guest. It's about acting in ways that are fair, discreet, and respectful. This builds positive reputation not just for you, but for the entire OT profession. Consider a team meeting with a physical therapist, speech therapist, and doctor discussing a client's care. The PT suggests an approach you believe conflicts with the client's OT goals. Fidelity guides how you handle disagreement. Instead of saying, "That's terrible," you respectfully articulate concerns. You might say, "I appreciate that perspective. From an OT point of view, I'm concerned about impact on dressing independence. Could we integrate both goals?" It's about professional respect. Fidelity means loyalty to your profession. You have responsibility to adhere to the code of ethics and encourage colleagues to do the same. If you witness unethical or illegal behavior, fidelity gives you the duty to take action, reporting to supervisors or licensing boards when serious. This isn't being a tattletale. It's protecting the public and upholding profession integrity. Fidelity is your pledge of allegiance to occupational therapy values. So there you have it. Beneficence, non-maleficence, autonomy, justice, veracity, fidelity. These 6 principles are the 6 secrets that are now yours to keep. They are not just abstract concepts. They are your new ethical compass. As you move from classroom to clinic, this compass will be your most important tool. There will be times when the path forward is clear and easy, and times when you find yourself in dense, foggy ethical dilemmas with no obvious right answer. In those moments, you can pull out this compass and look at these principles. They will help you find your bearings. The journey of becoming an ethical practitioner is the real curriculum of your OT education. Your classes will teach you the science of anatomy and the art of activity analysis, but it's the ethical challenges that will truly forge you into a therapist. You will have to make hard choices, have difficult conversations, balance client needs with system demands. It won't always be easy. Sometimes it will be incredibly hard, but making the ethical choice is always the right choice. It's the choice that lets you sleep at night. My advice to you is this: stay curious and stay humble. When you face an ethical question, don't just guess. Talk about it. Bring it to your professors. Discuss it with classmates. Ask your fieldwork supervisor for guidance. The American Occupational Therapy Association has an ethics commission that provides advice and support. You are not alone in this. Ethical practice is a team sport. The more you talk about ethics, the more comfortable you become using your compass. It's a skill, and like any skill, it gets stronger with practice. As you continue on this wonderful, weird journey, I want to leave you with encouragement. Being an ethical occupational therapist isn't about being perfect. It's about being thoughtful, reflective, and committed to trying your best to do the right thing every single day for every single client. You are entering a profession with a deep legacy of compassion and integrity. These principles are your connection to that legacy. They are the secrets that will transform you from a student into a trusted, respected, and truly great occupational therapist. Now go out there and do good. Remember, these 6 principles are always there to guide you. Beneficence, do good; non-maleficence, do no harm; autonomy, respect choice; justice, ensure fairness; veracity, tell the truth; fidelity, keep your promises. You are the future of occupational therapy. Carry these principles with you, and they will never lead you astray. Your ethical compass is now calibrated. Trust it, use it, and let it guide you to a practice that truly makes a difference.